At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Hormones, Menopause, Andropause, and Beyond on Wednesday, November 13th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle DC, interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Welcome, everybody. Happy Sunday to you. Dr. Tom here. Got another great program for you. What a beautiful day. Perfect fall day outside. It's a little cool, but it's great. And those of you who are out running the Marine Corps Marathon, God bless you. I'm glad that you can do it. And maybe one of these days I'll get motivated again to do that kind of mileage. But you know what? I think those days may be gone. So I applaud you. Good for you. Good going. We have a program today. We're going to talk about something very interesting that unfortunately in Western culture, we suffer way too much of. And it affects both women and men. Generally, at first blush, we wouldn't think it affect guys, but it does. And what are we talking about? We're talking about your own personal warm summers. I'm talking about hot flashes. And as we get into the areas of our life where so many of us go through pretty rough menopause and something called andropause. So, you know, ladies, when you wake up in the middle of the night, you're kind of soaking wet or you got these rages of heat that kind of show up out of nowhere, you know, that kind of stuff. And you're wondering, what can I do about it? And everybody's telling you, well, you know, it's one of these things that everybody goes through. Well, let me tell you the truth. Not so much. Not everybody goes through all this. And it's unfortunately that in Western culture, like so many other things, we're much more prone, susceptible, if you will, to these things happening to us, and you know, emotional breakdown and anger and so forth and so on. So we're going to talk a little bit about why that occurs, but more importantly, if you follow me into the live stream today, as soon as we're done here, go to drtomroselle.com and go to live stream. There should be a box that'll pop right up. All you got to do is hit it. You follow me, and then you get to see the face behind the voice, if you will. And we're going to give you some how to fix it type of thing. We're going to kind of allude to it right now, but also I want you to remember that coming up very quickly now, this is going fast. Not only election time is coming, but on the 13th of November, 1-3. I guess I messed it up the last couple programs, but it's really the 13th, 1-3, since I've been admonished by everybody. Say it the right way, Dr. Tom. So the 13th of November at the Roselle Center in Fairfax, Virginia. We're right off the National Capital Beltway, Route 50, probably a third of a mile off, maybe a smidgen more than that. And come join us. It's going to be at 6 p.m. on a Wednesday evening, the 13th. And we're going to get into Dr. Stephanie Pina and I are going to co-host. And Stephanie is an amazing physician. She's doctor of naturopathic medicine. She's also an acupuncturist. But we're going to look at this from what can you do about these imbalances that cause these things that we don't want to experience. I mean, it should go really easy when you hit that time of your life when, you know, when your menstrual cycle shuts down, guys, when your testosterone level starts dropping. But what is it, if you will, that causes this ugliness that occurs, that wakes you up in the middle of the night, that, you know, unfortunately gives you the stress levels of, oh my gosh, right? So we know that stress will affect both andropause and menopause. We know that. So, and stress comes in multiple different formats. So what are we talking about? We're talking about just environmental, you know, work periods that are over the top. Well, that's part of it. But also stress often comes from the surroundings that we, you know, have experiences with. And what I mean, workplace, family issues, pushing too hard. Stress also is pain that doesn't go away. So let's talk about these hot flashes, and then we're going to talk about some relief patterns. And you're going to join me at 12:30 and go to Dr. Tom Roselle live stream. And by the way, on all your social media sites, whether it's Facebook or whether it's LinkedIn, whether it's Instagram and X and so forth, follow me and like me, and we will let you know what we're doing, when we're doing it. And these programs will pop right up. So if you're out in the car, your cell phone will say, hey, he's ready, and you can turn it on. So if you do that and pass it on to your friends, so we can give you all the information that you deserve. Now, hot flashes, that really warm, uncomfortable, unfortunate situation. Well, let me tell you what really is going on there. What's really going on is that these hot flashes, which seem to be the natural time when you stop producing estrogens. Now, guys, what does that have to do with you? Because you produce estrogen as well. And you also produce other things. See, we produce testosterones and estrogens and progesterones. It's just different levels. And that's what we really have to understand. It's a different process, it's a different impact. So the natural time is when, for ladies, is when they stop producing eggs from the ovaries and they no longer are in that place where they're going to have children. Guys, it's when your body says, man, I don't need to produce as much testosterone, i.e. other hormones that go along with it. And because I don't need to really, even though that you can impregnate as easily as they should, before you're just like, okay, let's get this stuff done. So, but your ovaries, ladies, stop producing and releasing eggs. Guys, you slow down as well. But a lot of this comes from, remember we said stress? So why is stress so important? We're going to talk about two different organ systems today. We're going to talk about your fight-flight system, your adrenal glands, like we always talk about those. And we're going to talk about liver and liver detoxification pathways. Now, the hot flashes that we get, these surges of uncomfortableness, this intense heat feeling that you get in your face and your neck and your chest and sometimes other parts of the body. Does it have to do with anything besides that? Yeah, we can get into niacin and niacinamide and so forth, which will cause that, but that's not what we're really talking about. So if you really dig into it, the hot flashes are the most common symptom of transition. We're going from one part of our life to another part of life. It's a natural time that we go through, but you shouldn't experience this stuff. It's kind of the bell that rings, says, oh, by the way, next round. No, it should just be an easy transition. But unfortunately, we don't transition as easily as we should. So your doctors refer to this as, hot flashes as a vasal meaning blood, motor meaning something's pushing, symptom, or if you look it up, it's going to be simply VMS. Everybody likes alphabet soup these days. And during a hot flash or these warm, intense feelings in your head, neck, and face, sometimes, you get large amounts of sweat and you feel chilly afterwards. You go from hot to really cold. Well, let me tell you why you feel cold afterwards. Your sweat causes this cooling effect. Is actually called countercurrent heat exchange. And what that means is that the evaporation of the sweat in the air cools down the body. So that's also a natural process that your body goes through. So over 2/3 of people assigned female at birth. I had to say that, right? Assigned female birth. They have alphabet for that too. It's like AFAB, assigned female at birth. Come on, let's get over this crap. Anyway, if you're an XY, you have certain types of hot flashes, and guys, if you're an XX, you have certain types of situations. So regardless of what you declare you are, we have to look at genetically, right? So what does it feel like? It's an intense heat, and it feels like it's inside your body. And guys, you can get that too. It's like you're kicking the covers off at night, and you trying to find someplace that's really cold that you can sleep in. You have this flushing. The skin becomes hot sometimes and red, and especially in your face, as we said earlier, in your chest and your neck and your ears and your back and so forth. And then you get the sweating. Chills after a hot flash are over is excessive loss of body heat that occurs, and that causes problems as well. Your heart rate will kick up 7, 10, 15 beats per minute. And then you get this crazy anxiety feeling. It's like, oh, right? So anxiety is sometimes just because you don't know what the heck is going on. Hot flashes can be caused by different types of things. But what we have to do is we have to look at those challenges. We're talking about stresses. We're talking about injury patterns. We're talking about biochemical aberrations, exposures. But here's the bottom line. Let me get down to, what really is problematic. Now, I want to make sure that you understand that hormonal disorders such as thyroid problems and tumors and diabetes can also cause those things. Neurological problems, that have a problem starting in the intestinal tract, because that's where most of your neurotransmitters are produced. Sleep disorders, digestive function like GERD, and so forth and so on ad nauseum, right? And then viral infections such as COVID and the flu and so forth. And so you got to rule a lot of things out. And if doctor's just throwing meds at you, then I would think that maybe you better have another consultation and get a second or third or fourth opinion on this. But we see this stuff all the time, and you have to dig to find out what really, really is triggering all this. 35% of women who are pregnant said they had a hot flash at some point during the pregnancy. I think it's a little bit more than that actually in today's world. And that's a piece of statistic I grabbed out of PubMed, but it's in reality, if you go to Nature, if you go to some of the other ones, the statistic goes up a little bit further than that. So if we have these breakdowns, if we have these hot flashes, and if we go to the place that we're saying, okay, it's due to estrogen metabolism, and that means that estrogen is either not present or it's unbound, not bounded, means not tied up, binded, or the liver is not able to convert it into a water solution and get it out. So here's the deal. Let's take one of these pieces at a time so I don't continue to confuse you, because I got a lot of feeling that some of you are sitting there listening to this and saying, what's he really saying? But we're going to talk about treating the symptoms. But let's talk about what actually is taking place in this craziness that, that's upsetting so many people, and it shouldn't happen. And that's the whole piece. It shouldn't happen. So estrogen, if it's not converted into a water solution so your body can get rid of it. Now we're talking about liver function, which I'm going to talk about at the live stream, phase 1 and phase 2, and you can actually understand why you screw it up, why you're having a lot of these problems. So initial stages, if estrogen is not balanced out properly by progesterone, then these estrogen titers, even though that they may be low, are, if you will, they're unbalanced because the progesterone is too low. What makes that take place, particularly as you're going through menopause? What makes that happen is that your fight-flight system, your adrenal system, has got its butt kicked, and you're not producing the amounts of estrogens that you should. Or here's another piece. When that adrenal system is not producing estrogens and progesterones in balance, and you have an estrogen dominant, even though your estrogen is low, again, you got to take a look at why that takes place. Now we go back to our stress pattern, and we go back to biochemical stress, as well as emotional stress, as well as neurological stress. Let me tell you how that happens, because it's important that you understand it. So we'll take the obvious. We'll take the emotional stress. So if we're constantly in a state of emotional stress and we internalize that stress just so we can continue to live with whatever it is that we have to put up with on a day-to-day basis, that stress doesn't go away. It's still there. And we continue to churn it, and we continue to balance it until we can't. But along the way, it's affecting that outer shell that we've talked about so many times of the adrenal systems, called the adrenal cortex. And that shell is so responsible for keeping normal transition, meaning going from your youthful you to your menopausal you. And those things should be an easy transition, but they're not, because we kind of beat ourselves up. Now, there's other things like thyroid problems, which we'll get into some other time, maybe even on the 13th when you come and listen to the presentation. But here's the deal. If you're under constant stress, just emotional stress, your body's going to go into protective mode. It's going to drive your cortisol up, which is going to take your blood and push it into your peripheral arterial system, your arms, your legs, your chest, and it's going to put it into your heart. It's going to take it away from your organ systems. It's going to take it away from your liver. It's going to take it away from your ovaries. It's going to take away from other pieces of the puzzle. Why? Because the tiger is chasing you and it's going to eat you. And if the tiger catches you, you're going to be dead. So your body tries to do whatever it can to fight the tiger. And that means that you have to either stand and fight or run away. And either way, your cortisol is going through the ceiling, and everything else that adrenal system should be producing no longer is producing it at the level that it should be produced. What are those other things? Well, a lot of them have to do with what we're talking about, menopause, right? Because it produces something called pregnenolone, which converts into progesterone. It produces something called DHEAS, which goes into the first stage of testosterone, and then testosterone. And guess what happens there? It produces 3 different forms of estrogen. One's a good guy, one's a bad guy, and one's well, you can need a little sometime, but you don't need it all the time. So if those things get unbalanced, you set the stage for a problem. And along with that is the hot flashes and the night sweats and the mood changes. And also, guess what? You feel a lot more pain in your body. That's right. So if your adrenal system, your fight-flight system is not working and you're going through andropause, guys, or menopause, ladies, you're going to have all of these unwanted symptoms, the sweating and the burning up and the reactionary process that you go through. You want to bite somebody and the pain, you just hurt all over. And that's not necessarily fibromyalgia or myofasciitis or any of those things. It's your hormones not doing the job because you're stressed out over the top. So we have to put together an understanding of why that is. When we go into the live stream, I'm going to talk about the phases of liver detoxification and how it relates to all of this stuff. Because if that old liver of yours is not pathological, we're not talking about pathological changes. We're talking about functional problems where if you don't fix the function, you don't get it to work the way it's supposed to, then it's like a domino effect and so many other things begin to happen. So if we know that, wouldn't it be great to take control and responsibility and be able to change a few things? I don't know about you, but short answer for me is, yep, absolutely. And I'm that place in life where, I should have gone through andropause, right? But I didn't go through the dump like a lot of guys do. I didn't put on that extra 30, 40 pounds around my waistline. I didn't go into the I'm going to take your head off and hand it to you type of phase where, unfortunately, a lot of guys do that. They go from, gee, I married this really wonderful guy, and now he's a pain in the lower extremity. So, and also, ladies, unfortunately, you become way less tolerant. And you want to, your ability to handle things isn't there. You wonder, and you come up with the thing, raising children is meant for young people. And, the old cliches of grandparents, right? We get to, play with them for a few minutes and love them to death and then go home and they get to stay with their parents. All of those are tolerance things. And we're talking about similar situations, but we're going to talk about how that fixed. But here I'm here to tell you that the majority of this stuff, these menopausal processes, can be resolved. Now, there's a pathway, and I don't expect you to know this pathway, but I want you to know that you're hurt at least one time if it comes up, right? So estrogens regulate the hepatic effects of growth hormone as well. What does that mean? That means that hepatic means liver, and there's a lot of things that are going on there. So it's when the liver doesn't work the way it's supposed to. And I remember I said we're going to get into phase 1, phase 2 detoxification in the live stream. Then nothing is going to work the way it's supposed to, but the liver is responsible for breaking down and balancing other hormones. So estrogen reduces the fat content in the liver, all right, exclusively from these receptors that are designed to do that. So anything that affects liver function, phase 1, phase 2, we also know there's a phase 3, but the primary is phase 1, phase 2, is going to affect the signaling of these sex hormones, estrogens and progesterones. And also when we talk about this growth hormone statistic, because it's tied to it, it's tied to the ability of repair, tissue repair. That's, how you look, that crinkly skin that you don't want, the deposit of collagen. There's a lot of that's all tied together, and we want to know why we're suffering so much of it. So I'm here to tell you that you don't have to suffer, that there's other ways of making this resolve itself. And we're going to talk about that in just a few minutes. So don't forget to join me in the live stream as soon as we get done with the program, because we're almost there. And I want you to go to drtomroselle.com and make sure that, you do what's right for you. You understand the process. That way you can ask the right questions. You can say, hey, doc, what about this? It's like they don't understand. A patient came in the other day and she was having, all these symptoms. And I said, has your doctor run X, Y, and Z? And she says, no. And she just looked at me like I was a squirrel. But hey, listen, here we go. We're going to go to the live stream right now. And I want you to remember something, that I do these programs because I want you to ask better questions. I want you to have a great life. I want you to be control. Ageless Health. Health is a do-it-yourself program. Your health is a do-it-yourself program. Remember that on an ongoing basis. Remember that, we have to get it done the right way. We're going to the live stream in just a second or two. And remember, I'm here every Sunday for one reason and one reason only. You deserve the data, but more importantly, I love you. Join me on the 13th at the Roselle Center for Healing. Now join me right now on Ageless Health live stream. Going there right now. See you in a minute. Bye. If you understand what's causing it, you can fix it. You can turn it around, which we do all the time at the Roselle Center for Healing. We know how to reverse this. But you have to look at structural patterns, you have to look at neurological patterns, you have to look at hormonal problems, and you put it all together for the individual, for the person that is suffering from this condition. And it's extremely painful in some conditions, but more importantly, here's the deal. If you have osteoporosis, you're hurting, you're in pain, you're hurt all over, up and down that spine, your hips hurt, and muscles hurt too, because your muscles need calcium as well. But when you can fix it, it's like somebody lifted a veil, somebody reversed it, somebody made a difference. We're coming up to the break in the program. I want you to make sure you join me immediately after this on Ageless Health live stream with me, yours truly, Dr. Tom Roselle. And go to drtomroselle.com, make it happen. But follow me and we'll let you know when it's happening. Okay, so let's go to the other. You get to see this crazy face of man. And remember, we do this ongoingly. One reason only. I truly love you all, and you deserve the information, and I want you to be smarter than all the docs out there. Join me in a second. Let's go. I'll meet you there.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular
Neuromuscular dentistry is more than just teeth and gums. Neuromuscular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. Hi, this is Dr. Tom Roselle, host of Dr. Tom Roselle Live. If you're in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Visit softtouchdentalcare.com or call 703-319-6990.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Hormones, Menopause, Andropause, and Beyond on Wednesday, November 13th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com. That's rosellcare.com.